Good afternoon, everybody. My name is Dr. Amaya Kulkarni, a board-certified cardiologist practicing in Northern Virginia with the Mid-Atlantic Permanente Medical Group. And I am honored to welcome you and all of you in Facebook land and our illustrious panelists to this session talking about the pediatric COVID vaccine. And so I'm joined here today with Dr. Christina Brown, Dr. Beth Carella, and Dr. Carla Hanash. And I'd love for them to introduce themselves to you as well. So let's start with Dr. Brown.
Hi, everyone. I'm Dr. Christina Brown. I'm a board-certified pediatrician practicing in Baltimore, Maryland. I have 2 children, ages 3 and 4, and so we are very excited to be talking about this topic today.
Great, thank you. And Dr. Carella?
Yes, hi. Hi, everyone. I'm Dr. Beth Carella. I'm a board-certified pediatric hematologist and oncologist working at the Capitol Hill Medical Center in Washington, D.C.
And Dr. Hanash?
Yes, hi, I'm Carla Hanash. I'm a board-certified pediatric cardiologist who actually grew up and trained in the area. I work off the Capitol Hill Medical Center. And I have 4 wonderful boys, age 15, 13, 10, and 6. So I'm also very excited about this topic that we're going to talk about today.
Well, that's great. And I thank you all for spending some of your time with us today, and also for sharing about who you are in terms of your family, because we are really all, in this pandemic, we are helping our patients and their families make these important decisions about the COVID vaccine and many other decisions about their health. And also, we're making those decisions for our own family. And so I'd love to hear from all of you. Maybe we can start with Dr. Hanash about how you thought about the decision-making for the COVID vaccine for your family. So Dr. Hanash?
Yeah, so as I said, I have 4 boys, and obviously I do have a background in epidemiology, so I love statistics. And, with my background in science, I sort of look at the numbers. And to me, it was really quite evident that it would be safer for my own family, including my mother who's older and my kids, to get vaccinated. Also, I made the decision not just because, but I really researched it and looked at the data and talked to my husband, talked to the family, and even the boys, got them involved in terms of the decision making. And, to me, the benefit of getting them vaccinated far outweighed the risks of it. I wanted them to lead a normal life, to go to school, to partake in sports, which I think is excessively important for our pediatric population, just for not only their physical health, but mental health. So we took all that into consideration and then came to this decision that, yes, that we would move forward in vaccinating the kids. The older ones have already been vaccinated, and the other 2 are actually scheduled to be vaccinated in the next couple of weeks. So, I took it from a scientific standpoint, but more importantly, from a parent standpoint, and I wanted the safety for my kids.
Yeah, I think I think we've learned more than ever before how critical it is for our kids to be participants in their communities and societies. And I think that it's so true that sort of thinking through the real benefit to children of getting the vaccine is critically important. Dr. Carella, your thoughts on how you sort of approach this with your family?
Yeah, so similarly to Dr. Hanash, I read the papers and looked at the research behind the vaccine. I have multiple nieces and nephews, one who is 12, and so he's already received his vaccine, and the other 3 are scheduled to receive theirs. Also to speak to the immunocompromised population, I think probably all of us have a family member who's immunocompromised, and protecting them is something that a lot of people kind of put out there to consider because their immune system may not be as able to respond to the vaccine or to the virus.
I think that's a great point, and I think that we all, like you said, we all have that a few sometimes members in our family who are their body's unable to produce an immune response, and so the chance to protect them as well. So that's I totally hear and feel that. Dr. Brown, your family experience, I'd love to hear your sort of perspective.
Yes, so my daughter will be 5 in December, so we were counting down the days till she can get it herself as well. I tried to sign her up already for a December date after her birthday, but I'm a little too early, so I will have to sit back for a minute and wait our turn. But you know, I think our actions here speak louder than words. We are all physicians, and we have children and nieces and nephews, and you know, we've done the research, and we are excited to get our families vaccinated. My nephew got vaccinated on last Friday, and you know, I was able to see him over the weekend, and he was excited, and you know, he's been looking forward to this for some time. So we are very grateful for this coming soon for us too.
Yeah, I think that the almost 5-year-olds are probably the most excited about this this last step. So I'll tell you all I'll share my my family story. My older daughter is 10 and my younger daughter is 7. And I mean, they have been waiting since I got vaccinated to get theirs. They have been so excited about the shot. And, you know, we've had really earnest conversations about, you know, what it means to get the shot and how it's beneficial and how, you know, what it means to have risks. So it's been a really neat chance to sort of share some of the thinking about science in this world with our children. And both my girls are getting vaccinated next Monday. They actually wrote a song about it, which if you guys are lucky, I'll put it on YouTube. It's a parody of Guns and Ships, you know, from Hamilton, because we love Hamilton. So they wrote a parody of that to celebrate the vaccine. So they're very excited about it. You know, one question though that my older one did ask is, the younger one just asked if the shot's going to hurt or not. The older one did ask about side effects of the vaccine. So maybe Dr. Brown, you can tell us a little bit about what we know about the side effects of the vaccine.
Sure. So in the trial for the 5 to 11-year-old age group, the most common side effect was pain or soreness in the arm. So about 3/4 of the group reported some pain and soreness in the arm. There was also some reports of fatigue. Fever was present in less than 10% of the group, so more rare. So these are similar to side effects that we see from other vaccines, that pain and soreness in the arm. There were no cases of myocarditis seen in this study. So I know that's been on a lot of people's minds as well. And I know we will talk about that more shortly as well.
Yeah, let's actually talk about that now, because I think that that's the thing that that's probably on a lot of parents' mind, especially parents of adolescent boys, because at least in some of the data, there was some concern about myocarditis in boys. So Dr. Hanash, in your professional, actually in your personal experience as a mom of 4 boys, tell me what your thoughts are on, and what we know about the risk of myocarditis.
Sure. So as you may know, myocarditis is the inflammation of the muscle of the heart, and it's an immune response that affects the heart muscle. Myocarditis is not new to us. It's not, you know, the most common reason for myocarditis is viruses. And throughout my training or my practice, I've seen multiple cases of myocarditis related to viruses. So that would also include the COVID virus. You know, as far as we know, the risk of myocarditis associated with the vaccine is minimal. It's very small. And obviously, being a pediatric cardiologist myself, I had to really research that question, and having boys, none of which were 16 at the time of their vaccination, I really was interested to kind of see, you know, what the pathophysiology of it is. But knowing that, and I'm looking at the data, it seems that, you know, most cases have been very mild. The majority of which have not required hospitalization, whether in the hospital or in intensive care units. And most recover very well with just, you know, supportive care like NSAIDs or rest at home. And the recovery is within a few days. So this is what we've seen or have been documented with regards to myocarditis related to the vaccine. This is in sharp contrast actually to what we've seen with myocarditis, even though it's still rare, and of those affected with COVID and myocarditis. Children tend to get hospitalized more often. They tend to require more ICU care once hospitalized. Their hospitalization time frame or the recovery time frame is much longer. And they require much more supportive care than what we've seen with the vaccine. And I know one of the pediatric cardiologists did the talk not long ago, Dr. Offit, where he sort of compared if you were vaccinating, if you had a stadium of 100,000 people in it, and then none of which were vaccinated, your risk of COVID myocarditis is about 1,300 or so, versus if you had the same stadium and everybody was vaccinated, out of the 100,000, your risk is 1 to 2. So, statistics really show that even though there is some risk of COVID vaccine-related myocarditis, the risk is very minimal. And in comparison to really COVID myocarditis, I think it's worth that risk. And this is not to even talk about the numbers associated with MISA, which I'm sure we'll touch upon at one point or another, where the risk of myocarditis is even higher. So when I'm looking at the numbers, that risk is too small for me not to recommend vaccination for my cardiac patients, as well for family members or anyone, all my patients that have reached out to get the vaccine or not. So I've recommended the vaccination for that due to the little risk that's associated with it.
Yeah, I really love the way that you framed that, because when we hear the word myocarditis and you're not a cardiologist, oftentimes it sounds like a monolith, that's a single disease that everyone gets exactly the same way. But as you're describing beautifully, it's not the same thing to every patient, and the myocarditis associated with the vaccine is potentially, even if they were to get it, it's potentially significantly milder than that associated with the virus. That's a beautiful illustration. That stadium example I'm going to borrow.
Yeah, and
really
absolutely.
Nice,
And one thing parents don't realize, so if I were to follow a patient with COVID-related myocarditis, it has long-term effects. I mean, a lot of my athletes, they can't go back to athletics for 3 to 6 months post-COVID myocarditis, where my patients, which I have not yet to see, I've seen cases of COVID-related myocarditis, but none of vaccine-related myocarditis. But, looking at the data, these kids are back doing their sports, doing their activities, within 7-10 days, even shorter than that, versus the other kids that I have to restrict. And believe me, they're not happy with me. They're not happy. So right. There is even not going beyond the acute phase of it, there is a long-term phase of it that, parents need to consider with regards to when they're looking into the numbers and the statistics and with their kids and sports they're in.
Yeah, I think that's a really, again, wonderful illustration. It's all about relative risks, and I think that's a perfect illustration. Yeah, Dr. Pearl, I have a question for you. There is a lot of talk about the relative risks and benefits for kids 5 to 11. We hear that kids are at lower risk for getting the COVID infection and being hospitalized or dying from it. And we know that the vaccine is very safe. I'm curious to hear how you speak to your patients or how you counsel your patients about thinking about vaccinating their 5 to 11-year-olds or their children in general.
Yeah. So I think typically I'll start the discussion to kind of similar to Dr. Hanasha said, what we've seen in our office in general pediatrics, I'm in specifically hematology and oncology and cardiology, we see the patients who have had COVID themselves and specifically multisystem inflammatory syndrome, which is a syndrome specific to COVID that people have seen predominantly in the pediatric population. And so typically, I'll present that the patients that I've seen with any type of untoward effects have been all those who have actually had COVID and none of whom have received the vaccine. I think something that's really encouraging for families to hear is that millions of people, there have now been, I think, almost 14 or 15 million doses of the vaccine given in the United States. And very, very few serious adverse events have occurred. And the two that are detailed very, very kind of just specifically on the CDC website are anaphylaxis or severe allergic reaction to the vaccine, and then a blood clotting disorder that adult patients have experienced, again, a very, very rare side effect, and specifically with the Johnson & Johnson vaccine. And so, you know, I usually encourage, or I always encourage my patients to take it, and discussing, you know, that side of it. Whereas the adverse events, you know, when they've looked at the adverse events, the serious events that have been seen in the clinical trials of about 5,000 children have been, you know, about 0.1%. And I think an important statistic that parents appreciate is that serious adverse event that is specified in the research and in the data is the same. It was not statistically different. In fact, the number was 0.07% for serious adverse events after vaccination versus 0.1%. So technically that number being higher, but not statistically significant in the placebo group. And so meaning that the patients who had serious adverse events were, you know, just the same in number as those who received the placebo. So, you know, I encourage patients to receive the vaccine. Something else that has come up is the kind of time to evaluation of the vaccine. I think it was very helpful for patients to hear that most vaccine side effects occur within 6 weeks of administration of the vaccine. And so the CDC or the FDA under their Emergency Use Authorization required a 2-month evaluation of the CDC of the vaccine, and the average evaluation in the clinical trial was about 3.5 months in terms of evaluating these patients moving forward. So those are kind of the numbers I usually use to talk with my patients and educate regarding kind of making an informed decision on the vaccination.
That's great, and a particularly important population to discuss the vaccine with, I'm sure, in your practice. Dr. Brown, maybe you can talk to us a little bit about the different doses of the vaccine for children, and a little bit about dosing intervals and things like that for the 5 to 11-year-olds.
Yes, the 5 to 11-year-olds will receive about 10 microgram dose. So that's compared to 30 micrograms for the 12 years old and up. So it's about a third of the dose. So this is because not looking at weight-based dosing, like in pediatrics, we dose a lot of medications based on the weight of a child, but with vaccines, it's different. We're more looking at the maturity of the immune system. So for example, if you think about the HPV vaccine, the human papillomavirus vaccine, we used to give the same 3 doses for younger children and for older teens, but we learned that the immune system for younger children actually builds a much better immune response. So now looking back at the data, there's only 2 doses now given compared to 3. So it's similar. We've learned that the younger children build a better immune response, and so that's why they can have a smaller dose. It's not just based on their size. So it's similar to adults in that they'll both get 2 doses spaced apart by 21 days. And for children, the only approved vaccine right now is the Pfizer vaccine.
Got it. That's really helpful. And just asking another question about that same question about dosing. You mentioned that it's based on sort of the children's ability to build an immune response to the vaccine. If they're are parents who have children who are, say, 14 years old, but they're small, and so they're not, you know, they're the size of a 10 or 9-year-old. What are we recommending in terms of dosing differences for those children?
Right, so those children should receive the appropriate dose based on their age at the time of vaccination, not based on their weight at all. So another way to think about it would be for babies who are born prematurely, it may be a very different size compared to babies born on time when they come to 2 months. So if they're there at their 2-month checkup, no matter if they're 5 pounds or 15 pounds, they're getting the same exact dose of the vaccine. So it's based on the immune system response rather than on the weight of the child.
That's a great analogy. I think that's I like that comparison to the premature baby in terms of building an immune response. All right, so now I have a question for all three of you. You know, from our Facebook audience, we had a few questions about the way the vaccine was created and tested. And I'm sure all of you, not only in your professional but in your personal lives, have heard people express concern about the vaccine itself. So I'd love to hear all of your opinions on the data behind vaccine safety and efficacy, and your thoughts about the real world data that's come out after that. You know, just about the vaccine in general. Now, I want to say that one of my favorite phrases in sort of the vaccine discussions has been at Grady Memorial. They have what's called a no judgment zone, where people can ask whatever questions they have, however foolish they may feel asking the questions, and there's a physician there to help answer the questions. And I kind of view this environment like that. So, you know, we should share sort of what we have heard and you know, answer the question, you know, about safety and efficacy of the virus. So I'd love to hear, of the vaccine rather. So I'd love to hear from all of you. Why don't we start with you, Dr. Hanash, and then we'll go to Dr. Kurella and Dr. Brown.
Sorry, I had to unmute here. So, you know, with regards to vaccination in children, obviously, as parents, family, children, when we make decisions for kids, we really take things seriously. We really take things very slow with kids. We, you know, we always use the adult testing and then bring it into kids, just because, you know, it's our kids. So we don't, you know, we don't go too fast. We're adult, you know, we've lived our lives, and we're not that much of a big deal as kids are. You know, so I think looking at the data, I mean, the clinical trials have been done with the vaccine. The vaccine isn't just rolled out. I mean, they're doing it on the age group for which the vaccine was intended for. So, you know, the research is robust. There's committees that are outside, you know, that also review all the data before it even gets to the FDA and CDC, you know, in order for us to do recommendations. So it goes through rigorous evaluation, and the data is nitpicked at any point. Now, granted, it's based on a smaller percentage. So, you know, until we actually roll it out, we won't know the major things that may occur. But we've seen, I mean, we've used vaccination forever. And typically what we see in the clinical trial typically follows sort of the same thing as what we would see in a population-based vaccination. So, you know, with the exception of a few cases here and there, but in general, it's pretty consistent. So I'm very confident actually about the research that's been done and the clinical trials that have been done for kids. You know, if I wasn't, I wouldn't vaccinate my own. So
that's great. Dr. Kurella, you want to share your thoughts?
Sure. So when you were asking that question, one of the things I was thinking about is, you know, this being a vaccine that is kind of engineered differently than what a lot of people think of for traditional vaccines. So you know, the fact that this is an mRNA vaccine, meaning, you know, there's a piece of kind of DNA or sequence of information that creates a protein. So it shows our immune system when we get the vaccine, a protein that's on the surface of the virus. So some viruses are, or some vaccines are engineered in that you get kind of a weakened version of the virus, or you know, some of the viruses or the vaccines that we give are considered live vaccines. And so this protein is you know, inactive, completely inactive. And so what it's doing is exposing our immune system to this and teaching, saying, hey, this is foreign. Immune system, please prompt a response, so that in the future, if we see this protein on the surface of the coronavirus particle, then our immune system has been taught how to respond to it. And so it's one of the common concerns I think people have is, you know, and similarly to the flu vaccine, people will often, you know, share their concern that they themselves acquired the flu after receiving the flu vaccine, and some people then specifically are asking, am I going to get coronavirus from the vaccine? And so there's no plausible medical or any type of response that our immune system can have that can cause us to get coronavirus after receiving the vaccine. All it's doing is training our immune system to respond. And so, you know, some of the side effects that people are seeing that Dr. Brown mentioned, either you know, a reaction at the site of the injection, or, you know, fatigue or fever, you know, those are all, you know, for better or worse, a way our immune system is creating a response so it learns. And so in the future, if we're exposed, you know, we don't actually have the infection, or if we do get the infection, we have a muted version of it. So I think that's a common concern, and you know, it's of course understandable, but that's not the way that this vaccine is designed.
That's great advice. And Dr. Brown, your thoughts?
Well, I'd also add that this technology, the mRNA technology, has been, you know, researched now for a couple decades. It just hasn't turned into something major like this because it didn't have the same funding and attention like it has recently. So started to look at it with other coronaviruses like the MERS and the SARS initial coronaviruses that got attention in the news previously. So it's been looked at before, but it finally got the funding and attention to make it big. So this is exciting. Every decision we make as parents is trying to weigh those risks and benefits. You know, everything we do every day, you know, and as a pediatrician, I just want what's best for your children. So when families are coming to me asking about it, I review some of those risks and benefits. But to me, the benefits of this vaccine far outweigh the risks. So let's talk about some of those a little bit. We've talked about a lot about the risks, but the benefits are huge. So first, it decreases your risk of hospitalization and death from this horrible virus. It also decreases your risk of kind of this long haul COVID, kind of that we're calling it this post-COVID syndrome, where some children, about 1 in 12, have months of symptoms after a COVID infection. So months of fatigue, sometimes anxiety, chest pain, shortness of breath. I have a prior athlete who gets winded walking up the stairs now, and it's been several months since his infection. So the vaccine can help prevent all these things, and also that horrible MIS-C, so that multi-system inflammatory syndrome in children that can just be devastating for children, for, you know, wreak havoc on, you know, multiple organ systems in their body. So it, you know, I've seen a lot of heartbreak these past almost 2 years. I've seen a lot, you know, it affects families in so many different ways. And so to me, this vaccine is incredible. It can save lives, but also really help keep children in school, keep them in their activities, you know, acting as children should, not going out on quarantine every 2 weeks and the back and forth. I know I've heard endless tales of children struggling with the the virtual learning or struggling with the social isolation. So I'm, I get goosebumps just talking about it because I am so excited. And I think the vaccine also brings back some control into the situation. So much has been beyond our control, but we have the control. We're getting back control of this, that we can, help end this horrible pandemic.
Yeah, those are some great thoughts, and I especially like the way that you were framing sort of let's think about what it can give us, and the idea that the vaccine can potentially give us all our lives back. I think that is a really powerful motivator for my family, and for sure, So I'm an adult cardiologist. I'm an adult congenital cardiologist, but I'm an adult cardiologist. So we started having these conversations about vaccine safety, in December and January when it first started rolling out for adults. And I think that one of the things that I have learned along the way is that in general, all of us anchor to the things that we hear near us. And so when we hear about the person that we know who is fully vaccinated and gets an infection, gets the COVID infection or hospitalization, we think that maybe that is more common than we are realizing. But the beauty of the moment we're in now, the beauty of 2021, is that we have so much availability of data that we can really check our anecdotes against the available data very easily. And one of the best examples I can give is that I live in Virginia. So I looked at the Virginia data today, and the risk of dying from the number of people who are fully vaccinated in the state of Virginia who have died from COVID, of the 5.3 million people who've gotten the vaccine, is 754. That's an incredibly small number. Now, that tells us that no vaccine is perfect. Some will have breakthrough infections, and we know that. But to frame what that means, I took some clever statistics, and to frame what that means in the context of things we know, you're more likely to bowl a perfect game, to find a four-leaf clover, or become an astronaut than you are to die if fully vaccinated from COVID. And so that tells you how dramatically beneficial this vaccine is in the overall population. And in terms of the data, I think that as all of you have mentioned, there is phase 1, phase 2, and phase 3 data, and we often would hear about why people worry that it happened too fast. That vaccines usually take 4 to 7 years at minimum. The fastest vaccine before this one took 4 years to develop. Why did it develop so fast? And I think that the two things that maybe folks don't think about as much in terms of vaccine development. One is certainly the money that is required to run these large clinical trials correctly. But the second is the prevalence of the disease. So when there is, in order to prove that a vaccine works with a certain number of patients, it needs to be around, right? It has to be present. And so when you have a global pandemic, you can actually find patients to enroll much faster, and you can understand with some certainty whether the thing works or not much faster because it's around more. And so I think that those two things were sort of things that contributed to faster data than we ever would have gotten in any other time in our history. And so I am super conscious and attentive to the data around the vaccines because, the big risk in vaccines seems to be myocarditis. So I try to make it my job to pay attention to sort of the data on it. And I am constantly amazed at how deep and broad the data is on the COVID vaccine. It's, there's 7.3 billion doses of the vaccine have been given so far, and the safety signal is incredible. So those are my thoughts on the safety and efficacy of the vaccine. I don't know if we're sort of approaching the end of the hour. I did want to ask one more question to you, Dr. Brown, about the kids under 5. What are your, do you know anything about when the kids under 5 where the data is going to come out, and anything about that process?
Yeah, I don't have any concrete dates for you, but I'm on the edge of my seat and constantly looking out for this. So I've heard winter. I've heard early spring. Yeah, I think to be determined so far.
Yeah, I think what I'd heard was that the trial is deep in enrollment or completely enrolled for the Pfizer 6 months to 5 years, but that I think it speaks to the deliberateness of these organizations, that they're going to take their time to understand that they have the right data and the appropriate amount of data before presenting to the FDA. So it's going to reassure us further that we have really, really good safety data. So,
and I'll add too that many pediatricians and other physicians enrolled their children or tried to enroll their children. So that just shows, how excited they are about this as well.
Yeah, that's a really great point. I think all of our physicians' Facebook feeds are full of our friends, who enrolled their children in the vaccine trials, and so that's telling as to sort of our belief in the vaccine. I'd love to sort of get a final thought from all of you. Maybe we can start with Dr. Kurella, and you can tell us sort of if you had one thing to share with our friends and family and our Kaiser family in Facebook world. What would you say?
Sure. So I would take kind of lean on my specialty being the oncology patient population in the pediatric realm. And, it of course applies to adults as well. We all have family members who are immunocompromised. And while I have encouraged every one of my immunocompromised patients to get the vaccine, of course, their immune system is not as strong. And so there's now data we give kind of a third primary vaccine to those patients so that their immune system kind of gets more of the dose so that they learn and are able to make a better response. But I think one kind of final point to make is that a lot of the immunocompromised population is still at high risk. And so those patients are protected by the community that is around them also. And so I think we all have family members that are immunocompromised, and these children kind of need the rest of the community to kind of trust in the vaccine and help protect them so that they too can take part in school and community events, and we can all kind of get back to a more normal life.
I love that sentiment. Dr. Nash, you're going to have trouble topping that one, because the idea that we get to be the sort of protectors of our community with this act of kindness towards our neighbors is going to be a tough one to beat.
I can't beat that. Thank you, Dr. Kurella. I can't possibly beat that. My final thoughts would be, don't underestimate the impact that COVID has had, both physically and emotionally on our most vulnerable population. And the quote that I've seen and heard that I think is the best is basically, make the safer, less risky choice. And I think that really summarizes my feel about it, and that would be the message that I'd like to, to put out there. Nothing comes without risk, but I think, as parents, we make decisions for our kids on a daily basis, and it's always risk-benefit. I think that the vaccination route is a safer, less risky route to take.
Yeah, I think that's a really great point. I think that we as clinicians, as parents, we're having these conversations every day with our children and about our children. This is just another one of those conversations, and I think it's a really great point. Dr. Brown, what you got?
Yeah, I could talk about this for hours, but I'll try to limit myself. One, I think, I get a lot of questions of, coming up with questions that feel out of nowhere. There's just so much going on the internet, and it's hard to know what to trust. So much misinformation out there. And so, you know, when you're doing your own research at home as a parent, as a friend, you know, make sure you're looking at reputable websites. So I look at data from the CDC, I look at information on the FDA website, I trust the American Academy of Pediatrics. So you have to make sure that you trust the sources that you're reading from. So I've also gotten some questions about the emergency use authorization, you know, and if it's okay to use it for kids, if it's only under EUA. So I would encourage people to look at the FDA website. There's a whole section about what is emergency use authorization, and what it means. And I'll add that the vaccine has been fully approved for adults now. So I expect that it will be fully approved for children as well. It just takes more time. And for something to make it to emergency use authorization means it's been looked at rigorously and it has been shown to be safe and effective. So you know, I have no fear about getting it just because it's still under emergency use. So I'll also add that in practical terms, if people are looking about, you know, where do I go? Where should I get this vaccine? So for those with Kaiser Permanente insurance, you can get it at one of our centers. You can look on kp.org and click on what's called an e-visit, which is basically just scheduling the vaccine if they have appointments available. But I also encourage anyone to go to your local pharmacy or your local hospital group, you know, look online for whatever is convenient for your schedule. So some people choose to have evening appointments or maybe on a Friday so they can monitor their child for any side effects the next day. So, you know, you do what's right for you and your family, but as pediatricians, we're here to support you in this. So, you know, definitely reach out to your pediatrician if you have any questions about it. I'm excited and ready to answer questions about it as well. So all in all, it's, you know, with the information that we know at this time, you know, we believe it's safe and effective, and, you know, I'm very excited about this.
Yeah, I really love the sentiment that, you know, that you should come ask your trusted source. You know, your pediatrician is the person who helps get, or at least has helped keep my sanity with my two girls, and I think that this is another one of those decisions, and having a trusted source to help navigate those decisions is so important. So my closing thought is that I have always said, even before there was COVID, that the only stupid question is the one not asked. Because when you ask a question about your own health, what you're asking for is help in making decisions that meet your values. And the people who are best at helping you do that are the physicians and clinicians who have helped you navigate a whole bunch of other things, whether it's, you know, a heart attack or a kid with cancer or something else, you know. And I think that so what I say is that there, as you mentioned, Dr. Brown, there's a ton of information available on the internet. Some of it is good and some of it is not good. And our job as your doctors is to help you, give you context on that information, help you sort of frame it in the larger world of all the available information. And so at Kaiser Permanente, we have a no judgment zone. So if you have a question about the vaccine, you know, no question is too small or too foolish. And we just want to help our patients make the best decision for themselves. And so, and I know from talking to my colleagues in the area, across the country, across the world, almost to a T, physicians feel this way about caring for their patients. We just want to return to normal life, you know, and for all of us to be as safe as possible. So with that, we'll close this. I want to thank everybody for joining us on Facebook Live, and if you have any additional questions, feel free to add them to the comments in the Facebook live stream, and we'll try to get answers for you if we can. So thank you very much. Thanks everybody for your time. Thank you.
Thank you.
Thank you.